Hi, welcome to another episode on mednichewithDr.B, and today we're going to be looking at an amazing topic, and it says the ABCDE approach for medical emergencies. Now here's a step-by-step guide. Now what's ABCDE? A for airway, B for breathing, C for circulation, D for disability, and E for exposure. Now, this is a critical method used to assess and manage patients with potentially life-threatening issues. Okay, let's start with the airway. A. First of all, we need to make sure that the airway is open and clear so oxygen can reach the lungs. Now, you're going to be checking for obstructions. So you will look into the mouth and throat to ensure no obstructions such as food or objects. Now, you're going to be using a light if available. Okay, now, if the airway is blocked, now, you're looking at two scenarios. In a situation whereby the airway is blocked and the patient is conscious, advise them to cough. But if the patient is unconscious, we do this method, which is called the head tilt chin lift or the jaw thrust maneuver to open the airway. Now, let's move to B. B is breathing. So we need to make sure the patient is breathing adequately. The person is breathing adequately. So you observe breathing effort and rate. So you're looking for signs of labored breathing, rapid or slow breath, and any abnormal sounds like the wheezing or stridor. So basically adventitious sounds. Now, you're also going to be assessing for oxygenation. So one of the best methods is using a pulse oximeter to check for oxygen saturation, which we know the normal range is 95 to 100%. Now, if the patient is struggling to breathe, you may need to provide supplemental oxygen or assist with breath. But do this only if you're trained to do so. Now, let's go to C, circulation. So basically, we're checking for adequate blood flow and if there is any form of signs of shock. So what's the first thing you do? You check for pulse. So you're checking the pulse either on the wrist, that's for your radial pulse, or on the neck for the carotid pulse. Also, you'll be checking for capillary refill. So basically, you are pressing on the nail bed and observing for color return. Now, the moment you do that, the color return should be less than 2 seconds. Also, you're going to be looking at signs of shock. So, is the patient pale, cool skin, sweating, or any form of altered mental status? Now, I will advise you apply pressure to any visible bleeding and use a tourniquet if bleeding persists. Okay, now we're going to go to D. D is disability. So basically at this juncture we are checking for level of consciousness and if there is any form of neurological issues. But there is this amazing scale which can be used to test for level of consciousness, and that scale is called the AVPU. So AVPU scale. A is basically you're checking for alertness, the patient awake. V, you're checking if the patient responds to verbal instruction, so to voice. P, does the patient respond to any form of painful stimuli, so basically responds to pain. The U, is there any form of unresponsiveness coming from the person? Okay, now you look for signs of head injury or seizures, so basically like unequal pupil or any jerking movement. Now, don't forget to protect the patient's spine. Now, on the suspicion of head injury or trauma, keep the head and the neck aligned to avoid unnecessary movement. Now, E, which is exposure, and that's the last one. Now you're looking for any hidden injuries or conditions. So you're inspecting for additional injuries like bruises, swelling, or wounds. Make sure to check areas that may not be immediately visible at the first instance. So you maintain patient's privacy and won't expose only as much of the patient as needed for the assessment. Cover them afterwards to prevent hypothermia. This is very important. Now, don't forget you need to keep reassessing. Emergency conditions can change quickly, so you repeat the ABCDE assessment regularly as needed. Now, don't forget, this is a very important approach. Thank you for watching this episode, and don't forget to subscribe, like, comment, share. Very important. Keep sharing. Someone might find this video helpful. Thank you so much, and see you on next episode. Bye. So you keep reassessing. Oh my god. Wait. Do go now.